This government meeting is brought to you by Eastworks and our local cable subscribers.
Hi, everybody. Welcome to the Easthampton Board of Health monthly meeting. Just want to call for a motion to open the meeting.
I'll make a motion to start today's meeting, 2/22/2022 at 5:31 p.m.
Second that.
All in favor? Maggie, yes.
Beth,
Amy,
yes.
Great. And then Jackie, do you want to do, I just want to let everybody know that this meeting is being recorded. And before we go any further, Jackie, can you do a quick roll call?
Yes, this is a roll call of the Easthampton Board of Health. Maggie Hebert is
Here.
our chair. Amy Petrowski.
Oh, sorry,
muted.
Maggie. Or Amy.
thank you. Here.
And Beth Rist,
Here.
all accounted for, all present.
Thank you. So we'll begin today's meeting with public speak time, which will last no more than 20 minutes of the meeting. If you do not have a chance to speak, you may submit your comments in writing for discussion at a later time. Each speaker will have 2 minutes to speak. We will be prioritizing Easthampton residences and businesses. Your video will only be allowed when you're speaking during this public speak time and only for the individual speaker, with the exception of the Board of Health members and Health Department staff. If you wish to speak, you can let us know by virtually raising your hand emoji, which is under the reactions section at the bottom of your screen. And we do have some rules for the meeting. There will be no applause or emoji applause, no disruptions, no booing, no heckling, no intimidation, no swearing. Any comments will be respectful to the board. All comments should be addressed to the board only. Do not speak unless you are recognized by the chair. Any person that does not follow these rules will be muted and may be removed from the meeting. At the start of your public speak time, please state your full name and address or professional affiliation. And I do want to just quickly read the Mass General Law. In accordance with Mass General Law, we are required to let you know this meeting is being recorded and no one else should be recording this meeting at any time during the agenda. And so now we can proceed to public speak time. We want to start with Mayor Nicole LaChapelle.
Mayor, can you just state your name and address for the record, and your 2 minutes will start when you begin speaking.
Mayor Nicole LaChapelle, and my address 123 East Street in Easthampton. Thank you for the opportunity to speak at this Board of Health meeting. I want to first thank the members of the board, the health director, and Jackie Sinkowitz, who's the godmother of all things public health in Easthampton, as well as Megan, Harvey, Brett, and Bridget Diggins on this call for the outstanding job they've done throughout the pandemic and guiding our city into and around several challenges based on the opinions and desires, hopes of our residents, but following the good science. I am very sorry for all those I just mentioned to have to deal with the abuse, both verbal and in writing, around being threatened to lose your jobs or your credentials. I would say shame on you. I'm happy to have a conversation with anyone who wants to do that, but it has no place in a public meeting where we're making decisions on the entire public good. I would hope that people will share their opinions in a reasonable, fair way and understand that they are opinions only, and then anything that's cited in those letters would take under due consideration by myself as mayor, but also the members of this board and our public health staff. I thank the board again and those who support the board for the work and dedication to the city over this very perilous time. We're going into a third year of a pandemic we know so little about. It's very easy to go out there and find a link, a scientific link supporting your opinion, but this board has taken so much into consideration to chart us forward. Thank you.
Thank you.
Do you want me to call on people? Bree? Okay. Jean Powell Wilson, please state your name and address when you are able to begin speaking.
I'm trying to unmute you, Jean. There you go.
Oh, hello. Hi, my name is Jean Powell Wilson, and I am a clinical psychologist and a resident in Easthampton, Massachusetts, around the main street of Easthampton. And I would like to thank you for your work here. I know that it is not easy and that it is still a confusing time, but I believe that it is important to hear citizens of all different opinions. So thank you for that opportunity. I do believe that even though there are even though there are differences of opinion, it is still within my right to be able to speak. So my first point is that if this were about public health, you would be talking about myocarditis, which is a heart inflammation issue that has been on a warning label by Pfizer since June of 2021. And also FDA has also mentioned the warning of myocarditis, heart inflammation in young people, especially in boys between 12 years old and 17. This is so important to consider because this is a side effect of the vaccine. And I know that even last month, Dr. Leclerc mentioned that even though she wanted to follow the mask mandate, she wanted to follow the mask mandate and couldn't make any other decisions because she was following DESI. But in the recent times, DESI has lifted it on the 28th. But before that, she wanted to follow, she wanted to follow whatever the Board of Health says. So whichever way it is, it's whatever is still having the mask mandate. So my point is that it's important to consider.
That's time, Jean. If you want to just wrap up your sentence.
Okay, it's just important to consider that none of you on the Board of Health have a medical degree. You're not a physician, and requiring medical interventions, whether it's masks, vax, or PCR testing or quarantine, these are all medical interventions. And these are not, you're not physicians and you're not allowed to do that according to Massachusetts law. And I do have the exact number. Thank you.
James Bodie.
Hi, can you hear me?
Yes.
Okay.
Can you state your name and address for the record, please?
I'm Emily and I have a child in the Easthampton schools. I'm here tonight to ask that you revise the masking order to explicitly exempt schools from the mask mandate. Schools are essentially controlled environments, very different from a bar, a store, a library. Because of the controlled environment within schools, they are able to take steps to ensure a safe environment in a way that isn't possible in a truly public space. As we become more and more aware of the negative impact on education from masking, it is imperative we enable schools to make make decisions that meet their needs. Therefore, schools need the flexibility and autonomy to follow DESI guidance and make decisions based on specific metrics like vaccination rates and mitigation strategies in place like ventilation and testing. Please explicitly release schools from the town mask mandate. Thank you.
Next would be Shelley.
Hi, my name is Shelley Fournier, and I am letting you guys know that citizens of the Easthampton group have consulted legal
Shelley, can you state your address also, please, where you live?
80 Maple Street. I've consulted legal advice and have papers ready to file tomorrow, which includes over 16 pages of federal and state laws that have been violated with your mandates, not only that way, but also in the fact that you guys are operating illegal without a physician on your board. On top of that, I see my son struggling every day due to your mandates. We never signed up for school testing. We never signed any authorization to consent. You COVID tested my child in school during school time without our parental consent. A doctor note is not required by mass law. Easthampton Board of Health has an automatic max exemption for anyone who has difficulty breathing, but my child receives only 1 mask break a day. Our son had documented asthma. You denied a mask exemption when he asked for one several occasions, and you told us we needed a doctor's note. My child has suffered severe anxiety as a direct result of your mask mandates and vax policies. He has seen teachers and staff yell at children and carry them out of rooms due to noncompliance. He is traumatized as a direct result. He also has been sent to the principal's office daily for anxiety episodes in noncompliance of masks. The school is a place for education, not yelling at children. To comply with your policies, your policies are illegal COVID policies put in place by an illegal board of health practicing without a licensed practitioner. Mass General Law, Part 1, Title 10.5.1, Chapter 111, Section 26. Reference it via the email that was sent to everybody. If you think masks are effective, make it optional. If you want to wear a mask, protect yourself. Leave my child alone. You've inflicted enough harm. The school's mission is Easthampton's safe place to learn and grow. Knowing my child's experience and knowing those of many others, I believe you have failed the mission, and that's safe.
Thank you.
Next would be Scott C. Please state your name and address before you begin speaking. Scott?
My name is Scott Callahan. I live on Westview Terrace in Easthampton. The Board of Health, as well as other boards and committees, need to stop with their overreach into the community. We're over 2 years into this pandemic and are still under the thumb of our local government, and this needs to stop. At this point, the adults in the community have all the information they need about COVID to make informed decisions that best supports their own personal needs and the needs of their loved ones. As of now, I'm notifying the boards of health, the city, and the mayor that the Easthampton Board of Health is illegal and does not comply with Massachusetts General Law, Chapter 111, Section 26, which clearly states that there must be a physician on the Board of Health. In addition to not complying with Mass state law, the members of the Board of Health, the Easthampton Board of Health, have repeatedly violated Mass open meeting laws. These are laws that everyone on the Board of Health has read and has, by law, signed a certificate stating that they have read and understand the Mass open meeting law. I can only go back and retrieve minutes online from the Board of Health meetings through January of 2020. I'm sure if I could go back further, it would be obvious the Board of Health has been violating Mass law since before January 2020. As the Board of Health is not in compliance with Mass state law, the Board of Health is null and void. All COVID-related mandates, procedures, and protocols put forth by the Board of Health are null and void as well. As a matter of fact, the position of Health Director and Health Inspector are also null and void, as these positions were appointed by the Board of Health while not in compliance with Mass state law. If the Board of Health does not immediately rescind all COVID protocols, mandates, as well as personnel positions added by the Board of Health immediately, I'll move forward with filing complaints with the Attorney General's office, file suit against the city, those listed as Board of Health members and those appointed by the Board of Health for open meeting law violations and not complying with Mass state laws. Our group of concerned citizens have certified letters requesting proof of liability insurance and bond information to those members of the public body. Thank you.
Sean?
Good evening. My name is Sean Abbott. I live on Summer Street. I'm a new Easthampton resident, and I want to thank the Board of Health and Dr. Harvey. I love all of the COVID protocols that I've seen here in Easthampton. The only thing that I would love to see is the ability to enforce them a little bit more. I think that the right thing to do with mask mandates would be to follow the case counts and have specific metrics that we follow, and only change the case counts when those metrics are being met. So for instance, right now, Hampshire County has the worst case count in Massachusetts, and I certainly wouldn't want us to drop our mask mandate during this period of time when we still have case counts that are known to be extreme. Further, I think that vaccine requirements should be permanent. We should never drop vaccine requirements. The vaccine has been proven safe. It has hundreds of billions of people hours in the research. There's no reason to ever drop it. And really all I want to say is thank you very much for having these mandates. Thank you very much for putting up with a lot of stuff that you shouldn't have to put up with as public officials. And I hope that you will continue to hold the line, and thank you.
And next is Evan Zemmer.
Hi, my name is Evan Zemer. I live on 25 East Maple Street in Easthampton, and I just wanted to say thank you so much for everything that you've done throughout this pandemic. I have felt so grateful to live in Easthampton and so confident in your following of the science. There's so much to balance, especially now without quite enough doses for those immunocompromised adults and the youngest among us not quite vaccinated. I know what is before you is incredibly complicated. And I said this to whoever was in the office when I picked up our family masks, but I'm just really grateful to live here and grateful for all of you. I love that my kids have been wearing masks. All the kids are doing great in school with the masks that I see when I volunteer at Maple. And I am really glad my kids can help protect their friends' parents who are at risk. And I trust that you'll continue following the science. And I just want to say thank you. Thank you so much.
Next is Katrina R.
Hi, can you hear me?
Yes.
Hi, my name is Katrina Ripka. I'm actually not an Easthampton resident, but I used to live there. Is it okay for me to speak?
If you can, we'd like to prioritize Easthampton residents and businesses. If there's time, we can certainly call upon you, but I'd like to make sure we hear from everyone in Easthampton first.
Okay.
So it would be me free or my free.
Yep.
Hi, sorry about that. You hear me?
Yes.
Hi, my name is Maya Friso. I live on Northampton Street. Sorry about that. I just wanted to, let me just pull something up real quick. I just wanted to address that on January 14th, the CDC issued updated guidance stating that cloth masks provide little to no protection. And under surgical masks on the CDC site, it says they do not provide the wearer with a reliable level of protection from inhaling smaller airborne particles and is not considered respiratory protection. Children are suffering. People are starting to sue people. There are adverse events that the Wall Street and the insurance companies for life insurance are noticing now. So if you do not heed the people's requests to stop this, you will be held accountable. Thank you.
Jen Sandler.
Hello, thanks for taking my call on this public speak. I'm Jen Sandler. I live on Williston Avenue in Easthampton, and I have a kid in the schools in the 5th grade. And I just also want to express my appreciation. This is a very difficult situation. The last 2 years have been unprecedented. We have been at countless meetings. We are so fortunate to have a great deal of expertise in our community, and it has been very hard to listen to the science, which is only emerging, and science is really complicated and it changes. That they have new findings all the time. One of the cool things about scientists is that they change their minds in light of new data. It's not ideological. They're following data, which is always emerging, and I appreciate all the work that it has taken Bree and Megan and the mayor and the superintendent and the school committee to figure out how to follow that science. And it's never going to be perfect. And it's very challenging for it to work for everyone. And I really appreciate all the work that you all are doing to figure it out. And I trust that the decision that you make will be based on the best information that is out there at the time. And that when that information changes, that the recommendations will change too, and the policies will change as they should, not based on lay people's ideologies or ideas about what they personally want at the moment. Thanks so much.
Donald Torrey. Excuse me.
Can you hear me?
Yes.
Hi, Donald Torrey, 17B School Street, Easthampton. And I was just wondering when we could get rid of the masks in the gym. It's extremely unhealthy for me to be exercising and not being able to breathe. And I hear so much talk about science. I don't see any science when it comes to restaurants and bars. You walk in with a mask on for 20 feet, you sit down, you take the mask off. Is there some sort of science I don't know about? That's my only question. And you people do have a very tough job, and thank you for what you do. And that's all I have to say. Thank you.
Jed Stamus.
Hello, I'm Jed Stamus. I live at 13 Meadowbrook Drive in Easthampton. And I just want to thank everybody for participating, coming to the meeting. I'd like to echo what some previous folks have said regarding Jean pointing out some of the risks to children of an experimental medical intervention, an mRNA product that there's never been an mRNA product before, so it really does not fit the definition of vaccine, and the adverse events are being ignored. AERS has documented more adverse effects of this vaccine than any other vaccine, all the other vaccines put together. Also, I'd like to strongly advocate for masks being optional for all, and at the very least, consider releasing schools from the order so they can make decisions specific to their needs and the needs of children, because it's been shown through the science and scientific research that schools do not spread COVID, and we're down from our peak, our winter peak, and basically it's become endemic at this point. Most of the experts are saying that. We just have to learn to live with it. So I'm asking that mask mandates end, and vaccine mandates and passports are never implemented. They constitute tyranny, and the mask mandates are hurting our children. I have a son, and it's affecting his health. It's affecting his psychological health. And I'd also advise you to please follow Massachusetts open meeting law. As the last meeting, no comments were taken from the public, which I believe may be a violation of that law. Thank you very much.
Where are we on time for the 20 minutes, Bree?
About 2 minutes left.
Okay, so if Katrina, if you'd like to speak, I don't see any other hands up at this time.
Okay, can you hear me?
Yes.
Thank you. My name's Katrina Ripka. I used to live on Ferry Street in Easthampton, and I currently am a resident of Westfield. I used to love coming to Easthampton and doing business there, but I actually refuse to give my service or business to any city or town that thinks it's okay to violate a person's right to make their own personal medical decisions. Masks and this vaccine are both under emergency use authorization, and so they are considered experimental, and any medical experiment requires informed consent by federal law. So technically, if you're requiring masks or this vaccine mandating in any way, you're actually in violation of federal code regarding the protection of human subjects. In section 50.20, it states that no investigator may involve a human being as a subject in research covered by these regulations unless the investigator has obtained the legally effective informed consent of the subject or the subject's legally authorized representative. Have you asked for the informed consent of your residents? Thank you for your time.
Are we at time, Bree? Because some other people put their hands up.
I mean, we have a minute left, so it's up to you.
Jessica, I think you had your hand up first.
Hi, according to Mass State Law, Chapter 111, Section 26A, by vote of the City Council and approval by the mayor, a city may create a health department to replace the Board of Health. Such department shall consist of a commissioner of health who shall perform the duties of the Board of Health with the advice of an advisory council of health. The city of Easthampton has both of these and are again in violation of Mass State law.
So I'm assuming we're at time.
Yes.
Thank you, everyone, for your comments. I think we'll now move forward with our agenda, which our first item is to approve the minutes from the following dates. We'll start with 12/7/21. Does the board have any questions about?
I gotta
minutes?
update you guys.
I have no questions.
No questions.
So to some, and then the 1/4/22 minutes
No questions.
and 2/1/22.
No questions.
So we can approve the minutes for those three.
I'll make a motion to approve the minutes from 12/7/2021, 1/4/2022, and 2/1/2022.
Beth, we gotta do them separate because I have to abstain from the last meeting because I wasn't there.
Oh,
So
okay.
you
All right.
make a
I
motion
will,
for the first two and then a separate motion for the last month.
All right, I will amend my motion. I will make motion to approve the minutes from 12/7/2021 and 1/4/2022.
A second.
All in favor, Maggie, yes.
Amy,
Beth, yes. And I will make a motion to approve the minutes from 2/1/2022.
I second that motion. Amy will abstain. All in favor?
Beth, yes.
Okay, and then the next item is for Megan to discuss our current COVID-19 numbers, trends, metrics, and update for this month.
Hey everyone.
Hi.
All right, so I will share my screen just so we have a visual to look at while we're talking. I don't have a bunch of groundbreaking information. Most of it has been in the weekly dashboards, but just so we're, all on the same page. We have seen some this is this week's dashboard, and from last week, a nice visual of the way that our cases are decreasing in Easthampton. And so as you can see, we're really in such a better place than we were last time this board met. The drop, as experts have said, and then I pass along to you, I'm not claiming that I was expert enough to create that line of reasoning, but I'm bringing you the research that these infectious disease epidemiologists are talking about. And with Omicron, it looked like this really sharp increase, really fast, dramatic high peak, and then a fairly substantial quick decline. The thing we're sort of waiting to find out, and I'm going to skip ahead a little here, is that, if we look at locations where they were a little bit ahead of us in the Omicron surge, it does look like it plateaus a little higher than sort of case rates before. And that, this in particular is a graphic of case rates, but that's true of hospitalizations and deaths in these locations as well. So it's not clear if we'll see a plateau in Easthampton at this sort of higher rate, or if we'll keep going all the way back down to where we were before the Omicron and before the Delta surge, especially. But either way, the numbers really speak for themselves. It's great to be reporting much lower rates. Question? No. Okay. If you do have any questions or want to ask something, please stop me anytime. I think it's also encouraging that we are seeing these case numbers continue to stay as we look at current cases and active cases as we sort of project out to what's coming. I know there's been some discussion of how accurate these numbers are. There's no question that these case rates aren't underreporting. So the issue is that it's a good issue to have. We have access to home testing. That's great. We would not trade that for anything, but home testing numbers are not going to show up here. So anybody who tests positive at home on one of the rapid tests, even if they called their doctor to talk to them about it, their doctor doesn't have a mechanism for reporting that. If they took the rapid test at the doctor's office, it would be in these numbers. And of course, PCR tests are the numbers, but anyone who is just testing positive at home and then staying home after reporting it, those numbers are not here. That being said, given the way that this trend matches the country, the state, the country, all of the various locations that have gone through this surge, combined with what we see from sewage data, like it's pretty clear that we're in a substantial decline. So the actual amount of virus circulating in the community is probably a little higher than this 36.2 cases per 100,000, but this is an accurate sort of depiction of the trend. Other things that we've talked about in the dashboard and that narrative since the last meeting are things related to vaccine safety and how well vaccines work and treatments for COVID, just trying to get as much information as we can out there. So I know the dashboard is, today's dashboard is new, but here's a little preview. So I go through the narrative, which is posted to Facebook and possibly also on the city website. The current status of antiviral treatments, monoclonal antibody treatments, immunomodulator treatments, and convalescent plasma treatments. So we talk a lot about case numbers and a lot about vaccines and a lot less about treatments. And I know, folks are really anxious to start looking at like what living with COVID looks like. And so keeping our eye on those things, but also thinking about things like treatment options is really great. The caveat here that's not obvious in sort of this depiction or really in the write-up is how difficult these can be to get a hold of right now. Most of them are sort of in production and trying to get larger amounts of them out. Folks who are in rural areas might have real difficulty with some particular of these treatments. Some of the monoclonal antibodies are not being given as readily if someone is suspected to be infected with Omicron versus a prior variant. So we have really good treatments, but the degree to which they're really useful is like we're getting there. We're just not quite there yet, but it's really promising for us to be headed that direction. This is just me showing you that, this peak that we see in Easthampton, this is Hampshire County, seeing the same thing. The rates in Hampshire County are higher than Easthampton. So, we've gone back and forth with, are we higher, are they higher? And as is probably obvious, it's not, splitting the hairs on those differences is probably not real relevant. It's the sort of trend that we're seeing that's relevant. And the great news is that it's following through hospitalizations and ICU patients. And so the burden is decreasing. It's a little bit lagged behind cases, but tends to be like 2-ish weeks behind that we start to see those falling. So that's all great news. I also just popped in here to remind folks, not that I expect you to read all of this, but one of the narratives from 2 or 3 weeks ago about vaccines covers in some detail all of the adverse reactions that have been reported through that VAERS vaccine adverse event reporting system, with a description of how that system works, how any possible side effect is meant to be reported. People are using it properly when they report any possible thing that could be related, even if it seems pretty obvious from the outset that it's not related. Like, I got my vaccine today, and then later I fall off the curb and I break my arm. That sort of data is still put into the system. And then folks at the CDC are going through each and every one of those events that are reported. And anything that stands out as a pattern is looked into with a lot more detail. And the good news is that we know the system is working really well because it has identified myocarditis and these blood clots, TTS, as potential adverse side effects. And so information is provided. I just briefly stuck it up here and then in more detail in the narrative, so folks are able to access, information about, sort of right sizing the risk associated. So how many actual confirmed cases do we have of this, all identified by the VAERS program, and sort of how many doses have been given. So, 57 confirmed cases of blood clots out of 18 million doses of the J&J vaccine, that kind of information to sort of help you understand how it lines up with, frankly, with the risks of getting infected and some of these outcomes, particularly myocarditis and pericarditis, which is inflammation of the heart muscle and of the outer lining of the heart that generally occurs after infection with a virus. And if you look at the numbers, the risk of myocarditis or pericarditis after infection with COVID or any other virus is higher than any associated risk with the vaccine. So that information is available for folks. And then just sort of some thoughts about, what goes into this masking mandate decision. Certainly case rate and percent positivity, and we've seen a nice decline there, certainly burden on hospitals and healthcare providers. Testing accessibility, in a month we've seen dramatic changes in how accessible PCR tests are, and also how accessible rapid tests are. So that's really encouraging. Of course, you'll want to consider the safety of masking and the efficacy of masking. So are they safe for the wearer, and do they work really well? And we've gone over in some detail that those high quality masks, the surgical masks, but especially KF94 and higher masks are really, really effective at preventing transmission in both directions. And of course, considering the consequences of masking, there are no health concerns that have been identified in truly more than 80 observational and experimental studies on masking. At this point, there really are no safety concerns. However, it's important to note that there are consequences that are coming up in terms of social interactions, mental health concerns related to masking and the environment of masking, depending on what location the masking is occurring in. So not minimizing, any of those things, certainly, but sort of right sizing it and considering it along with all of the other pieces of information. The only other thing that I would add into that for your consideration is our vaccine rates in Easthampton, which are really high. I wrote, there's these articles coming out comparing, if your vaccine rate is this, what does it mean for your case rate and your hospitalization rate? Easthampton is more like a European country than the rest of the United States, which is great news, but we don't live in a bubble. We move in and out. Vaccine rates in Easthampton are higher than in some surrounding areas close by, and certainly higher than in some slightly further away areas, but that folks are traveling to fairly often. We also see, of course, 0% of our 0 to 4-year-olds vaccinated, and low rates of vaccine uptake among our 5 to 11-year-olds and our 20 to 29-year-olds. So there are pockets of folks who are still vulnerable. For the 5 to 11 and the 20 to 29, it's hard to say by choice for children, but the vaccine is available for that age group, but not yet available for 0 to 4-year-olds. That is probably not going to be available until realistically late April, somewhere along that timeline. So I had hoped that we would have that ready to go, but Pfizer and Moderna are still working on their clinical trial. And of course, we see differences in vaccine uptake by race and ethnicity, and there are folks for whom even 4 doses of the vaccine provide some protection, but not that high of a level. And those folks are who are immunocompromised or who are going through cancer treatments or for a variety of other reasons still remain at pretty high risk of a severe outcome, even if they are vaccinated. So I think that's really all of the information. This is just some of the visuals that I've had posted before. This is using data from Massachusetts. We don't have this individual level data for Easthampton, but just Massachusetts level data, trying to compare to some of those New York Times and CDC studies where they look at what's the difference in risk between vaccinated and unvaccinated. So we see the same pattern that we see throughout the country replicated in Massachusetts. And here is sort of that difference in risk. So, higher risk of infection among the unvaccinated, but the biggest difference comes in terms of the risk of severe illness and hospitalization and death. Any questions I can answer? And these are just our vaccine rates by race and ethnicity. This is here in 01027, so includes Westhampton, it's not just Easthampton. and then by age group in 01027. So pretty good vaccine coverage, 80% and higher, except among 5 to 11, 2029, and of course, 0 to 4s.
Megan, or Dr. Harvey, sorry.
No, Megan.
With Omicron, what's been the average age group of severe illness and or death? I don't know if that was in there somewhere.
It's not in there. That's a tricky one to answer because there's two things happening during the Omicron surge. One is that our older population is really highly vaccinated. And so if there were no vaccines, we would see very likely the same pattern of the highest risk among the oldest age groups. But that group is really well protected. They often, they're most likely to have the booster dose. And so what we end up seeing is that more so than ever before during the Omicron surge, children, pediatric cases, 0 to 18 years old are the number of pediatric cases is enormous. This is unlike any of the other surges that we've seen for a variety of reasons, including how transmissible it is. We have not seen differences with Omicron related to the case fatality or the case severity rate, which is to say that the case severity is lower in children than it is in adults, far lower, but it is more severe for children than something like the flu. So it's hard to sort of answer that accurately. I think I managed to avoid answering your actual question, but I think I gave you a little bit of information that is relevant.
No, that makes sense.
Yeah.
Especially the vaccination piece about the elderly and so on.
Yeah.
Okay.
I had a question.
Yeah.
The current case transmission rate, the colors, I'm assuming the colors on your dashboard correspond to the CDC's color coding in terms of moderate transmission, high transmission, et cetera, et cetera.
These align with the Massachusetts categories of transmission.
Okay.
Yeah.
So, all right.
So yellow is back in this like greater than 10 new cases per day with a percent positivity, somewhere around 5 or under, which indicates like there's definitely circulating virus. It's not super low risk, but we're not in that severe case of like, there's a ton of virus out there and we can't possibly control it. We're not getting enough testing done, that kind of thing.
Okay.
Yeah.
Does anyone else on the board or health department have any questions?
I did want to comment, Megan, on your comment about the rapid test not being reported. That's 100% true, but some good news that we learned at our state call last week on Tuesday is they're doing some studies in the eastern part of the state where they're testing sewage, and that would account for at-home tests, and that they're seeing decreases in as well. So that is good news.
Yeah, I think the consistency plus the sewage data indicates that this is a real substantial decline. I think putting any money on the fact that it's 36.2 versus some other number in that area is, you can't do that with this anymore. But yeah. I mean, the other thing that, I feel for all of us who are in the situation of looking through this data and trying to figure out what to do, it would be great if we had really consistent guidance that was evidence-based and not so much based on, the very real, but not necessarily scientific pandemic fatigue that we're facing. And trust me, I count myself among that group. I think the things to consider as you're deciding next steps are like, what groups are vaccinated versus not? Does it have to be a blanket decision? Are there specific groups that might still need to wear masks or should still wear masks, compared to a place like, I don't know, where a bar where everybody is over 21 and all of those folks have access to vaccines, the choice to take them. And, there's nothing that says you have to go into a bar, like that kind of sort of voluntary accumulation of risk versus, other types of locations in community. So lots for you all to think about, and I'm happy to help answer any questions if those come up.
I guess, and maybe this was in one of the slides, but what's your opinion on why Omicron is going down? Is it just the virus itself is kind of waning, or vaccines, or all of the above?
Yeah, I think what happens with these variants, and there will certainly be more variants. We're not done with variants. And for a variant to take over, it will take over, meaning become dominant over a prior variant. It needs to be more infectious. And the more infectious these variants are, I still think the best sort of visual metaphor for this is like kindling. If there's even 80 and 90% vaccine rates, that's still a lot of people who are vulnerable to being infected. Not all who will have serious illness, of course, but that just it's a strong foothold for something that's really infectious to, catch fire pretty quickly. But the flip side of that is that when it's super infectious, it seems to peak quickly and then drop suddenly. So that's also good news about these more infectious variants. And will we ever have a surge like this again? I think it's really hard to say for sure. I think we will definitely have some easier months ahead of us. If another variant is going to come and cause this sort of issue again, I think that would be some ways down the road. So that's also promising.
All right, anyone else? Thank you, Megan, as always.
Amy's got a question.
I don't have a question, but I just want to thank Dr. Harvey for the effort that goes into creating these type of visuals for us to look at and to support us in our decision-making process. They're fantastic, and it's a new service that we have in Easthampton. I am in Easthampton. It's a new service that we have here, and I think it's brought a lot of depth to our conversations and our decision making. So thank you.
You're welcome.
Okay, so we can move on to the next agenda item, which is discussion of our order titled COVID-19 Mandatory Policies and Procedures for Wearing of Masks or Other Face Coverings in the City of Easthampton. So I'll open this up to the board. Anybody wants to comment, ask questions? Do we want to lift the mask mandate? We do. Should there be certain criteria?
So I have thoughts and questions. Thoughts are in terms of the state's into their school mandate being February 28th. Like I am a little concerned about that timing being right after vacation and the concern for travel and all of that. Question I have, I was reviewing the CDC's mask recommendations, current mask recommendations, and that was why I was asking about our level of transmission. Just if we were going verbatim off of CDC guidelines, and the recommendations are partly related to if the area has substantial transmission, moderate transmission, et cetera. But obviously the big part of mask recommendations is vaccine status. And I guess my question is, what, if any, tools do we have in place or can we have in place to verify vaccine status for kids in school? Because I think, at the very least, if someone is not vaccinated, they should wear a mask until we lift the mask mandate completely. But those are just my initial thoughts.
I mean, we can do an advisory for that. I think that's a great idea for anyone who's not vaccinated or immunocompromised. They I would recommend that they continue to wear masks, or anyone who feels uncomfortable not wearing a mask. I think we need to be clear that if we do lift the mask mandate, it doesn't mean that people can't still wear a mask, especially if you're in a crowded public place. But I don't know, Amy, do you have, or Bridget, I know you're not on the board, but do you have any contributions from your public health nurse role?
I would just add real quick that the school does verify vaccine status.
Okay.
Yeah, I wasn't sure about that.
Until recently, I think it was 2 weeks ago, DPH did not align with the DESE guidelines for the masks. And maybe it was a week and a half ago. I don't know. Was it last week? God, time is so crazy. I think it was last week. DPH put out a new masking guidance. And personally, I feel confident following the DPH guidelines and removing the mask mandate and moving to what the state has recommended. I think there are a lot of really smart people who do this far more in depth than we are able to do it. And I think it's different than coming from like DESE in a political branch from DPH, which is much more a science-based branch. So I would feel confident following their lead with this. I think our infection rates are low, our vaccination rates are high. There's access to at-home testing, which there hasn't been until very recently. There's still access to the PCR testing. There is, what else is there? One more thing. Oh, now we're getting hospital capacity back. So I think all of those things, we've been here for 2 years, as the mayor pointed out, and we've been asked multiple times, like, what's our off ramp? Like, when do we stop this process? And for 2 years, we've been talking about all of those pieces as a part of the puzzle that goes into creating that off ramp. And right now, I think Megan is right on from the information I have, like that trend that we've seen across the world with the Omicron is that it's going to continue. I think, Beth, you're probably right. The next week we might see a little blip because people are traveling this week for school vacations. But I think overall, Megan, the data that Megan presented us is spot on. So following the DPH guidelines is, I think, where I stand.
So my couple of questions are, it kind of aligns with Beth, is, do we do something to hopefully counteract any post-vacation mild surges? And also, I kind of feel like we need to define if metrics start to go up, like how far up, like what, we don't have to put a specific number, but I just feel like we need to have some kind of guideline as to when we would change. If we lifted the mandate, when would we reinstitute it? Like, what would be our barometer for that?
I think we use the same pieces of the puzzle that I just mentioned, right? Like the same pieces that we put the mask mandate on for, the same scientific data sets that we've been using to talk about why we're keeping it on. And if something were to go really haywire with any of those, like we see a variant that, kids are dying. We see something where we can't keep hospital beds open. We see a variant, like there are things that I think will make it a really clear decision of what we need to do and why, following those different pieces that we've counted on this whole time.
Right.
We're also on weekly calls with DPH, and I'm assuming those are continuing for the future. And they kind of help guide us as well with what they're seeing across the state, and they're really leaning towards, or they're basically at personal responsibility. I think this far into the pandemic, people should know what to do if they're feeling sick. People should know what to do if they've been sick. If they need assistance, Bridget and I are here for helping with
any of that.
any assistance they need or guidance, but.
And I think also it's important to remember that any place of business, if we lift the mask mandate, any place of business can still require masks in their place of business. It doesn't mean that they have to lift it. If they would prefer their customers to keep their masks on when they enter the building, that's up to them. That's not our call. Anything else, Beth or Amy?
I mean, I definitely rely on your opinions, having been, I'm a new member to the board, so I've been through it all with you guys. So I certainly respect your opinions and your experience making these types of decisions. My comments and questions were more out of just sort of fact finding and knowing what the right move is. But yeah, I think I would respect your opinions on that. And I think, I guess the only question would be about timing and whether we want to follow the timing that was recommended by the state or.
Well, if we were to lift the mask mandate effective immediately, schools would keep them until March 8th at their next meeting, because the school committee would.
Oh, yeah.
So we would actually cover the week after break by waiting for them to vote their mask mandate out. So
no, that's great.
I think we should align with that to avoid any confusion. And
my only concern that I think we should discuss is the 0 to 5. Like what do we want to do? Well, 2 to 5, because you don't have to wear a mask under 2. And daycares and guidance that we're giving that population. They're still unvaccinated. They're unable to be vaccinated, unable to protect themselves or have their parents protect them. And daycares are notoriously known for their spread of their germs. So do either of you guys have a thought on that?
I mean, I know my personal preference will be to have my 4-year-old in a mask. I think if we're following guidelines, they're not vaccinated, they should be in masks. But the question is, are we going to make it personal responsibility across the board? You know, I don't know. I have agreed. I'm not sure I know what the right thing to do is.
do we have any statistics on what's going on currently in the daycares?
Well, Megan just said that we've seen a really high infectious rate with our children during the Omicron surge.
Right.
Bree, have you heard anything from EEC? Because I know initially they aligned with DESE, and then there was some thought that they might come up based on the DPH recommendations where unvaccinated are strongly recommended to continue to wear masks. Have we heard anything from EEC? Bridget, you look like you might have an answer to this.
Yeah, so EEC has changed some of their guidance. One thing I would just comment on is many of the children ages 2 to 5 still in daycare. While some of them do mask, a lot of them aren't masking appropriately still. So a lot of times in terms of COVID, we have the kids stay out for the full 10 days and not the 5 days because they are not able to mask. You know, some kids are really good about it, some kids are not. In terms of reporting for daycares, that's been a little more difficult as EEC has backed off and they do not have to report it to local boards of health anymore. So in terms of testing, if an individual is positive, they go home. For close contacts, if the parent allows, the child will remain in daycare but is required to test for the following 5 days while at daycare. And if the child does test positive, they must leave the daycare and go home and then follow the isolation guidelines.
Has there been any thought, any talk about what EEC might recommend in terms of masking, or are they sticking with DESI?
There hasn't been any further updates on that.
And does the DESI guidelines, Bree, allow, is there an exemption for unvaccinated? Like, so does the DESI guideline say if you're unvaccinated and you're in a school, you need to continue to mask?
If it did, I would assume it's an advisory only. I don't think the state has any requirements at this point. I could be wrong, but it's not really their style lately to have any requirements. But I looked at the most recent mask advisory just an hour ago from the state, and it was just the, well, I can pull it back up actually.
From DPH?
Yeah, but there's still the federal and some DPH requirements like in public transportation and such. So let me check.
Right, so the kids will still need to wear masks on the school bus and in the nurse's office at school buildings, and then in any other medical facilities. That's a federal law. We can't do anything about that.
Yeah, so it looks like it's just healthcare and day services and programs operated or licensed by the state. It doesn't look like daycares fall under the 7 bullet points that are still going to be in place. Daycares themselves can have their own policies and enacted by the directors.
So are you thinking, Amy, that we should make a policy for our daycare centers in Easthampton?
I don't know that I'm thinking that. I'm more talking out loud about is there some need to continue to protect the most vulnerable,
right,
who are unable to be vaccinated? Or do we offer education and support to the daycares around the importance of continuing to mask as you know, a support and outreach to local businesses versus a mask mandate, right? Like we can, if we vote to lift the mask mandate tonight, my recommendation would be that we put out, in addition to the press release that says we're lifting the mask mandate, is that we're also recommending to follow this DPH guideline as part of our public press release. In order to provide the education about what is still being recommended, where this isn't required anymore, but here's what they're saying you should continue to do. And so if we lift it for everybody through the town, do we want to do outreach to the area daycares and offer them support, like Bridget or Megan, reach out to the daycares, offer them support and guidance or anything that they might need to decide if they want to continue masking in their facilities? It's not a mandate, but we're helping inform people on the best public health practices.
I think that's a great idea. Because it does give them that sort of backup support that and starts a thought process for them and the parents. So yeah, I think that's a great idea, Amy.
Okay.
I agree. Yeah, I was going to suggest that we just strongly recommend that, you know, for these reasons, people continue to wear masks,
right,
as part of our, you know, press release.
And do we want to lift this immediately or like tomorrow?
No.
What do people want to do?
Well, I think we should be in line with the school. What did you say, March 8th is their next meeting?
Well,
is that their next meeting, or is that how far out they extended their mask mandate?
No, that's their next meeting. I don't know if it's for a fact if it's going to be a school committee vote or if the superintendent has the authority. That's just when their next meeting is.
Okay, got it.
But you could vote to lift the mask mandate, except for in schools until a certain date. I just don't want to speak on behalf of the schools because I don't know I just know that their next meeting is March 8th, but I don't know if it's a superintendent decision, school committee. So.
Got it. I thought what you had said is that they voted to accept our mask mandate, which would then probably need a vote to, I don't know. So we could vote to do it March 8th. I mean, we could, if people feel more confident giving it a week post vacation, or we could.
I do. I feel more confident waiting at least a week after school break. Because if there was a bump in positivity, people will be testing. If anyone has symptoms, they'll start happening. So I would like to add that as part of the time frame.
Dr. Leclaire is on the call. If we wanted to ask her a question.
Sure. Do you want to unmute her? Hi.
Hi, everyone. I can hear you.
Yep. So I guess, can you clarify some of what we just discussed, like what's going to be happening on March 8th and who will be making any kind of decision?
Yes, so next week, on March 1st, we have a policy subcommittee meeting, and we will look at a new mask optional policy to replace the mask policy that we currently have on the books that we've had since the beginning of the pandemic. So that will go through the policy subcommittee next week. And then on March 8th, that will be on the school committee agenda. They will need to resend the mask policy that they have and replace it with the mask optional policy before we can make an adjustment on our end.
Okay.
Would it be helpful if our mask policy ended at the same time that your school committee will be voting?
I think it will be, I think the challenge for us will be any mixed messages next week if the city no longer has a mask mandate, yet we are still expecting students to walk in the door with masks next week, particularly if the Department of Education has also dropped it. So it will be a challenging week and a half.
So if I think I understood you correctly, because I just want to make sure, is that due to the potential rise in cases due to vacation travels and a confusion that there might be because of the DESE guidelines and the Easthampton School Committee mask guidelines, that if we were to remove it tomorrow, it would create a challenging situation?
Yes, I think that's correct. And that's just my opinion.
I mean, it's good feedback because we know, I mean, we have seen the science. We know we probably are going to see a bump next week, and we'd like this to be as successful as possible. And, if we take off the masks and we see that bump and, I can.
Right, and we're doing so much testing in school and at home right now that, I think it's safe to say we would probably catch most of the cases next week that resulted from vacation. We're probably testing 1,400 staff and students a week in the buildings. And then we're sending home almost 900 test kits per week so that people can test additionally at home. So people that want access to test twice next week will be able to do that.
Oh, that's great.
That is great. So I don't know what the rest of the board is looking at, but I could certainly lift effective tomorrow.
Okay.
I would rather wait until March 8th that week.
Because of the bump.
That's kind of my thought.
Also to avoid any confusion that Dr. Leclaire was talking about, like if we have no masks in Easthampton, but yet kids will have to wear masks when they go to school, it's hard for everyone to keep up already, myself included. So
I agree, and I think that that alone, like just saying, let's just do it in line with, is not like a scientific reason. It's just a concern. But we do have the fact that it's school vacation. We know travel can lead to a bump in case. So we have reason to delay either way. So I think why not? Just like you said, Amy, like let's try to set ourselves up for the most success. And we've waited this long. We've had the mask for this long. Let's, in my opinion, I think wait another week, and March 8th would be good.
Well, we could do it effective March 9th because their meeting will be March 8th. I mean, Amy, how do you sit with that?
I want to make sure that we're making decisions, continue to make decisions in science. So yes, it would be convenient, and I understand wanting to be in line with the school committee and make this transition as easy as possible. And so for me, if we're going to do it, it's based on the expectation of an increase in cases and wanting to mitigate that. So we are most successful when we take the mask off on March 9th. If the driving factor here is to avoid some confusion, as much as that is not desirable, I don't know if that's a reason to keep it. So I think we just need to be really clear about the reason for why we're postponing it.
That's what I was trying to say, but you said it a lot more eloquently. That's essentially what I was trying to say, that like I think we have a basis, for delaying the travel, the potential surge in cases. So I agree that should be the main reason for making that decision.
So we could vote, to lift the mask mandate and then take a separate vote on when. Would that be the appropriate process?
I think we put it all in one motion. Like we vote to lift the mask mandate on this day due to, I think we should include in our motion why we're lifting it. I think that would be important. I would also, I really want to, I know we had a lot of conversations tonight, and my recommendation or my feeling about being able to lift the mask mandate right now is due to science and not accusations or threats of a lawsuit against me. I have been on this board now for 2 years, and I have done my best since I've been here to try to make decisions in the best interest of Easthampton residents and the people who come to visit the city, whether it's in the food establishments and our housing complaints that we hear, and throughout COVID. And I wouldn't be making a decision if I didn't feel like it was based in science, regardless of the threat of personal lawsuit. I took this job knowing that that was something that could always come up. But I want to state that for the record. This has to do with science.
I agree. And 40 years as a healthcare provider, even though I'm not a physician, I feel that I have a wealth of knowledge from my career, and I don't make any of my decisions based on politics or threats or anything else. And as a nurse, I've had to wear masks at work day after day after day, and we do it to protect ourselves and to protect the patients.
And I'm a physician assistant, and I work with patients on a daily basis with illness, and I treat patients with COVID. And that was part of the reason I wanted to become involved with this board, is a way for me to give back to my community as a volunteer. So I'm here just trying to use my experience and knowledge to help protect the citizens of Easthampton. And trusting the experience and knowledge of my colleagues, but also my own experience and knowledge and what I've read and researched on my own. And I try to stay up to date as possible, so we can all make good informed decisions.
All right, who wants to make the motion?
I guess it's either me or you, right? So, all right, I will make a motion to end Easthampton's mask mandate as of March 9th, 2022, because of our concern for a possible increase in cases after the current February school vacation. And with the, with the recommendation that people continue to wear masks if they feel protected and if they are not vaccinated, and as per recommendations from DPH. Sorry, that was really long.
Jackie, did you get all that?
Thank you for the video. I will.
I know, I was waiting for Jackie to say, can you repeat?
Nope, I have a video.
No, I can't.
So
do we have a second?
I'll second that motion. All in favor? Maggie?
Can we do discussion for 1 minute?
Yep.
I am still not sold on the March 9th date. And I might be a dissenting voice, and that's okay. I think we have the information in front of us. And I think we can do it tomorrow. And if you guys can move that motion forward, it will still pass. If you guys don't want to reconsider the date.
So why do you want to do it tomorrow, Amy? I guess that would be my question.
I think we heard from Dr. Leclerc that they do ample testing, ample surveying. She seemed confident that if there were going to be COVID cases, that they would catch those before they were able to enter the school. And really then the only reason that it stays is to be in conjunction with the parts of the town all together. And I feel like if we know that we're in a good place to do this, we should do it. And, the school has a great testing program. Let's let them use it. There's no need to hold everybody back for another 10 days. I just feel that way. I feel there's no need to hold back for another 10 days.
My thought process right now is, well, it's the state mandate doesn't end to the 28th anyway, but that's what day? That's next week, right?
Monday.
So it sort of doesn't.
We could do it tomorrow and it has no impact.
Right.
And we're just really talking about a week, right? If we did, as far as well, never mind, I take that back. The dates are getting confusing.
Yeah.
So we're talking about a week of students in school, potentially still with a school mask mandate since they haven't had their meeting yet, correct? And so if we look at it that way,
they create their own policies and their own.
Right. So if you look at it that way, the concern about a surge in cases is sort of irrelevant because they're going to be in masks until their meeting anyway, regardless of what we decide today. Is that correct?
As far as I understand, yes. Until the school committee meets
So they'll still be wearing their masks until
So-
their decision.
Yeah, like we have people who are going to the gym who have been compliant with us all along. Like we now know that it's safe. Like I don't know that we need to wait a week. I don't know what, I mean, I understand there's going to be a bump in cases, right? Like we know that. But if the school is doing a good job preventing those cases from getting into the school, we're not going to see spread. And it sounded like Dr. Leclerc was really confident that their program works. So
I also have to say that people do need to take personal responsibility and be cognizant of exposure, symptoms, possibilities, and keep the rest of the community safe. They have to take care of themselves and monitor themselves if we're going to do this.
I agree. So I will, upon further reflection, I will change my previous statement and say that I will agree.
So it would be
No,
based
I'm
on,
gonna make another motion. this is more comments, like I'm just,
you don't have to make the motion. You can amend your previous motion.
okay.
So you don't
But
have
I
to
was
try to
just
say it.
I was
Got it.
just commenting that I agree. I've changed my mind and I would be comfortable. I wasn't gonna make an amendment yet. I was just saying that I would feel comfortable with an immediate removal of the mask mandate. We can discuss further. I can make an amendment, but I didn't.
So just to be clear, if we lift the mask mandate beginning tomorrow, the school system wearing
Sorry.
their masks. Do your mask? Wearing their masks at least until March 8th, regardless. And with their monitoring and testing and so on, they would catch anything and follow their policies for someone who's positive. So, okay. All right, go ahead, Beth.
All right, so I'll make an amendment to my previous motion regarding the mask mandate to start immediately instead of March 9th. So it's to start tomorrow, February 23rd, 2022.
I'll second that.
All in favor?
Amy, yes.
Beth, yes.
Maggie, yes.
And Bree, when we do that press release, can we please put the DPH guidance with it? And make a plan for outreach to the daycares. And offer just support and guidance of, help inform them on the benefits of continuing to mask at that age group and offer our support in any way we can.
Okay, Bridget has a good relationship with them at this point, so she'll be able to, we'll work on that tomorrow.
Great. I feel like those daycares sometimes get left in the wind, but I'm glad that we've been able to help support them through this.
Okay. Next agenda item is the Health Director General update.
So that was a lot. I don't have a lot to really report. We finished giving out rapids to local businesses and we have some left, so we're gonna work to get those out. Unfortunately, rapid tests expire and the group that we have expire in May. So we'll get those out to groups and, vulnerable populations as best that we can. And the budget is due on Monday. So I unfortunately don't have it ready for you today because I'm going to take every minute up until Monday at 4 p.m. to get it done. And then I will go over it with you at the April meeting, unless we can talk about this.
Are we having a March meeting?
Well, this was technically our March meeting.
Oh,
'cause we
right.
moved it, but
Yep, you're right. Sorry.
And the only other thing I wanted to just mention, which is some good news, is someone stopped by the mayor's office today to just give her sincere gratitude to Bridget for, I don't know exactly what the story was, but she helped the residents partner substantially. So I just wanted to publicly announce that. So that's all that I have really for right now. I feel like we just met 3 weeks ago, so I don't have a ton. Oh, Amy, sorry.
Thanks, Bree. So in terms of the budget, it's due for you to submit on Monday.
Yes.
And then what is step 2? So when do you need our input by?
That's a good question. I want to say April 1st is coming to mind. So that's a good point, actually, if we're not going to meet till April. So let me get an answer for you, Amy. And then if we need to schedule a meeting just to go over the budget, normally I feel like I have way more time to get it to you, but this year was just a little bit on the fast track. So
if it's April 1st, we could have our April meeting one of the last 5 days of March. And that way we'll be able to have a discussion about that budget before the final date.
Yeah, good point, Amy.
I'll get back to you guys on that. Whenever the budget's due, I'll make sure that we're meeting ahead of time. And once I have it done Monday, I'll send you the draft. So you guys can at least look through it before we meet.
Sounds great.
Any other items?
I just want to thank everybody for coming tonight. It's nice to see so many people. There were 60 people here at one point, so it's nice to see so many people participating and coming out to talk to us.
Strong community in Easthampton.
All right, with that, I can make a motion if we're ready.
Sure thing.
Make a motion to adjourn.
I second that motion since Beth is muted.
Sorry, go ahead.
I needed time.
Amy, yes.
Maggie, yes.
Beth, yes.
All right, meeting is adjourned at 6:57 p.m., February 22nd, 2022.
This government meeting is brought to you by Eastworks and our local cable subscribers.